My name is Michael Goldston, and I'm 75 years old, from Northern California. Got to have the privilege to come to Northwestern and have a bilateral lung transplant. Adventure started back in January of 2022. I'd gone to my doctor for a yearly checkup, and I had to tell him that in my bicycling, that at the end of my rides, I would have a pain in the middle of my chest. So they sent me to have an x-ray, and there was a growth, if you will, in the lower left lobe of my lung, and they said it was probably pneumonia. Well, I went through 4 months of medications for that, and it had done no good at all. Actually had the mass had actually enlarged a little bit, so they sent me to a thoracic surgeon, and they did a biopsy and found out that I had cancer in the lower lobe, my lower left lobe. I had adenocarcinoma. My thoracic surgeon scheduled an appointment to remove the left lobe. That was in May of 2022. Went through that surgery and then the recovery. Approximately 4 months, I went through therapy after May and was doing okay through the rest of the year. In 2023, it was February 28th, I woke up in the morning, was having difficulty breathing. And my O2 level checked, and it was about 72, which is extremely low. And I had my wife drive me to the hospital, and I met with my pulmonologist that morning. So we did some testing at the hospital, pretty extensive, and determined that I had pulmonary fibrosis, idiopathic pulmonary fibrosis. So that was my lucky day that I got to go on oxygen for 24 hours a day. I was actually on 2 liters at that time, and I had to sleep with oxygen, and everywhere I went, I had to have oxygen. So through that year, my wife had done a lot of research to find if there were any facilities in California that would accept me as a transplant patient. And every one of them said no. At that time, I'd only been cancer-free for 2 years, and I was 74 years old. So those 2 issues deemed me not eligible for a transplant. My wife continued to search, and she found the DREAM program here at Northwestern. I actually got to speak with Dr. Che. He actually agreed to have phlebotomists come in and take blood samples of me in California. We did some video interviews, and he had my blood sent back to Chicago and had the blood analysis, and decided that I was an interesting case, is what he said. We agreed to have me come out here to Chicago, and I believe that was in August or September of 2023. They decided to have me go through the process to qualify to have a transplant. It took 4.5 days to go through all of the process, and in that process they actually found that I had a 70% blockage in an artery to my heart. So they admitted me to the hospital, I think the very same day that they gave me the information, apply to input a stent, and I had to wait 3 months after the stent was installed to be clear that everything was going to be okay with my heart and my vascular system. So they sent me home for 3 months. 3 months later, we came back to Chicago, and that was December of 2023, and started the process again to qualify for a transplant. Did qualify, and they had also found that I had a small spot that showed up through a CT scan that could have been cancerous. And so I then met with a radiologist and went through the process to radiate that spot. On February 8th, I got a call from the hospital stating that I would be second on a list for a set of lungs that were available. During the wait for that, they actually found out that the lungs that were there didn't qualify for transplant. The next day at 8 p.m. on February 9th, I got another call from the hospital saying, "We have a beautiful set of lungs for you. When's the last time you ate or drank anything?" Well, the last time I had eaten was like about 3 o'clock in that afternoon, and had just had water afterwards. They told me, don't drink anything and don't eat anything, just get to the hospital as quickly as you can. So we were at the hospital front door at about 9 p.m. on February 9th. And the surgery actually took place February 10th. I remember going into the OR and the bright lights and how many people there were. And I've been through some surgeries before. This one was like, I was really amazed at what I saw. And then the next thing I realized, I guess it was the next morning, that they had brought me out of my medications and I was awake. And I was actually breathing on my own.
Before then, how many liters of oxygen were you on?
I think I was on 8 liters before the surgery. They actually made me always feel that I was really important to them, and they wanted the best for me. I never felt anything different than that. I smiled through the whole process every time I met with nurses, therapists, doctors, and immediately having them all come to my room and stand around my bed and talk to me about the surgery and how I was doing and how well I was doing. That really made me feel really good to know that all of these professionals would care for me so diligently. My one moment that was the most probably discouraging, after they took me from the hospital, they took me to Shirley Ryan, and that is patient therapy.
Mm-hmm.
So I was going through speech therapy, physical therapy,
Mm-hmm.
and occupational therapy there. Difficult time I had was with that feeding tube that went down my throat, and they had left it in for 40 days. And during that period, I couldn't drink anything or eat anything because everything was always so dry that the speech therapy was just not working. My speech therapist, Katie, she was a real advocate for me to get with the doctors and talk about my issue. And it took probably another week of her advocating for me, and actually let her do a swallowing test for me. A couple of days after that, which was in March, finally, that they actually came to me and said they were going to remove that tube. And the minute they took it out, the relief was just fabulous. That is one of the things that I told myself, because I had gone through the lobectomy, and that was not a small thing. I mean, it was minor compared to a transplant, but the way I looked at that and this through the whole time was, we did this incredible surgery, and I have to look at that as a positive, really positive moment, and they gave me life again. So I decided that I would always be a good patient. Really encouraging moments were when I got to go through physical therapy and speech therapy and occupational therapy, and the advancements that I made. You know, I didn't really realize how significant they were, and I was pushed very hard by the therapist, which I really liked. They all encouraged me immensely. It was great to have them. To really trust this process and trust everybody that you get to work with within Northwestern Transplant employees. All of them go out of their way to look after you and see that you get what you need, whether it's medications, just as small things like being at home and not feeling good, having a headache or something, and they never fail to call you back. So it's really trust everybody that you get to deal with a transplant. For students that are studying here to be part of a transplant team, well, you're in a really good place to learn. I'm sure they'll do everything they can for students to know what they need to do, follow their work path. For people that are even thinking about doing this, it's a difficult decision to make, to actually think they're going to do this for you. I can tell you that when I got the call, we were 10 minutes from the hospital, and we got ourselves ready and walked across the street to the hospital, dragging my oxygen, and got in front of the door, and I just kind of stopped at the door and thinking, this is way different than anything I've ever done before. And my wife looked at me and says, you don't have to do it. And I looked, I know I don't, but I know there's only one other outcome. So we can change that outcome by doing this. So it's a difficult decision to go through. And I'll let you know, you really have to want to live to make this venture, to do this, because it's a difficult process. There's really not much that's easy about it at all. But if you're positive, it could be, I say fun, but it's very enlightening. And to me, I've just enjoyed almost all of it. After you have a transplant, there's a lot of learning for you to do. Can't go into everything that I had to go through to learn again. It's like learning to eat again, learning to swallow again, learning to walk, take care of yourself. It's really difficult, but the outcome is almost always positive, and I recommend it highly if you like living. I have a monthly call with a group of gentlemen that have all had transplants, and we get together on on an iPad so you can Zoom meet with everybody. And it's really, really a positive thing to be part of, because they can tell you what they've been through if you have questions about what you're going through and what took place with them. It's very, it's really a good thing to talk with others who have been through this process.
Thank you.
And I recommend it highly. And these programs are put together by Hannah Aller and Michael, the social workers for Northwestern. They really require you to have caregivers here. That is a very important part of the process. Because when you go home, away from the hospital, and living basically kind of on your own, it's very difficult to have the medication issues. You're feeding, you're sleeping, comfortable. It's pretty trying and very difficult on the patient as well as the caregivers. And having more than just your own spouse, say one caregiver, 2 caregivers at least for the first 3 months, highly important. Very, very important. That's something I think everybody should know. A couple things that are really enjoyable for me for making it this far. About a month ago, we got to go to North Carolina. We got to fly there about a month ago and meet our great granddaughter. But how many people get to have great grandchildren, right? So that's probably I don't know the right word, but that was the best thing I could do, is go meet my great granddaughter. That was fun.
Yeah.
So fun. Now we're on the downhill slide. About 2 months to fly home.
Oh,
We have
for you.
a flight scheduled the day after my year anniversary.
You want to go as
It
quickly
does.
as you can.
In February.
Yeah, so when February 11th comes around, we're going to be out the door and heading for the airport. So,
Good for you.
Yeah. Like I said, this has been an enjoyable process, and I tell my wife every day, listen to me, I get to breathe on my own, and I can do anything. I can now go out and walk 3 miles and not have to drag an oxygen tank, and only be able to walk around the block. It's great.